And then, the one where you're making too much estrogen, usually that comes from like fat distribution. So if you have more fat than muscle, there's a certain type of estrogen, estrolone, that stores in fat, and it essentially like leads to estrogen dominance because it's storing in the fat. And so you would really just focus on like getting into more of like a muscle distribution that could just downregulate how much you're storing. And then the third one, which is the most common one, is it's not being eliminated correctly. And so there's two reasons that estrogen is not being eliminated correctly. It's either not being detoxed properly in the liver, and I have a very good body edit on detoxing, and I talk specifically about phase one and phase two detoxification in the liver. And that is like kind of the first trigger of estrogen metabolism, is that you need to be able to convert estrogen into a soluble form. And so that all happens in the liver. And if the liver is congested for any reason whatsoever, I actually have two really good posts on the liver. One that came out, was it last week? And it was like the liver is like the most important organ for beautification. A lot of it has to do with this kind of estrogen, this role it plays in estrogen metabolism. And then the other one is a holistic doctor's guide to, or detox Bible, something like that. But it's in the body edit. So if you just go to body edit on the homepage, you'll be able to find those two. Um, and yeah, so essentially you want to focus on supporting liver's detoxification. There's different methods that I cite to do that. And then the second thing is you want to focus on elimination. And so sometimes, and honestly, a lot of the time in women run more constipated. And when you run more constipated, you're not, you know, pooping every single day, having an adequate poop every single day. That is actually how you get rid of hormones. So the only way to get hormones out of your body once they're in your body is to excrete them through like pooping, essentially. And if you're not pooping well, I will say, like, there's some pooping scales you can look at online, and that'll help you determine whether or not you have like adequate poops per day. But if you're not doing that, then you're probably running estrogen heavy, and that's just like how it works. The fixes for that, I did actually write an article on like estrogen dominance and like endometriosis, and I talk about in that the importance of fiber. Yep, exactly. Someone just said eating fiber pulls. Yeah, exactly, exactly. So there's something called the bean diet, and this was actually created by a biochemist, not a doctor, but she has coached a lot of people in using any types of beans, like any type of that super dense fiber component. It can be lentils, it can be black beans, kidney beans, white bean, it doesn't matter. There is an enzyme in beans that draws out estrogen and actually binds to it so that when you poop out the estrogen. And it is like super, I feel like, not talked about enough. It's truly the key to keeping your estrogen dominance down. Another way to see if you have estrogen dominance, which I love this kind of Ayurvedic way of telling if you have estrogen dominance, is you look at the tongue, and your tongue will have these like uh, pink pustules on it. I actually have a picture of it in one of the body edits. I think it's actually the detox body edit. And that also can be a sign that you're estrogen dominant. And that sign actually comes from not excreting the estrogen, because you know that your tongue tells the story of what you're holding, the toxins you're holding, which is essentially why in Ayurveda and traditional Chinese medicine you do the tongue scraper, because that alma, that layer on your tongue, is telling you everything that's kind of being held in your body. And then there's also a way to read the tongue, which is what like Ayurvedic practitioners use in order to tell you, you know, what's congested. Like you can see like liver congestion on the tongue and things like that. So the one way to see estrogen dominance is by looking at that, like the tip of the tongue, and you'll see these little like pink pustules. Um, okay. Sometimes I don't know, like, if you guys like how in the weeds I get on this stuff, but I feel like I go, like, super deep, and some people love that, and some people are like, "What are you saying, woman?" Like, um, but I feel like I yeah, I don't know, I just love talking about this stuff, and I love, like, learning about it as well and teaching about it, so I feel like I just have a lot to say on these things. Um, okay, so yeah, that's excretion. The other thing you can use to improve your excretion is psyllium husk, which okay, good. Go deep. We need to hear it. Yes, that's how I feel. I feel like we all need to know this stuff. And life would be so much better if we learned it so much sooner. Like I just feel like this is what should be taught in high school. Like how do you excrete your estrogen? Like, how do you prevent ovarian cysts and fibroids and all of these things that we get into our 30s and we're like, what the hell is going on with my body? Because no one ever told me that this was, how it works. Like no one ever tells us how our body works. It's so crazy. Even doctors, like, let me not get on that tangent because I feel like I would just take up hours and hours talking about how doctors just don't do the job that they probably should be doing. And that's not to shit on Western medicine because I would say that I am someone who like absolutely sees the value in it. I just think that there need to be more resources for the things that Western medicine doesn't do. And I feel like that's actually why I even like created a Black woman's apothecary was like there's so many gaps, there's so many holes, and if I can just fill in one for someone, like anyone, then I feel better, you know? Our physicians only tell us according yeah, exactly, and I do feel like as someone who was a physician and practiced and, felt the pressure of the system, like, the system isn't really built for them to tell you more than that, and that's the issue, right? Like, you get 15 minutes, you've got 10 problems you wanna discuss, and they don't have the time or the capacity. Like physicians are so run down. They're all pretty much burned out. Like if you meet a physician and you don't think they're burned out, they're doing a really good job at hiding it because I'm pretty sure every single physician is burned out. Like that is just from my experience working with lots of doctors. Like they are all burned out and running on limited fumes and it doesn't make for the most effective explanations. It doesn't make for the most patient listeners or the best educators. Like it's just so yeah. So I do feel like in terms of like resources, we just need more resources to be able to fill in those gaps because I feel like there's already just a lot of fucking pressure on doctors, unfortunately. Um, okay, I'm just taking a look at my notes to see what I already covered. Yeah, so we went through the liver connection, how I want to get rid of estrogen. Um, and then, you know, the one thing that I do think that a lot of people miss when it comes to the hormone connection, and this is actually what I see the most in my skin consultations, is going to be the cortisol connection. And I feel like cortisol now definitely is being talked about more and more as I drink my caffeine, which is definitely something that's going to increase my cortisol. But, you know, the key to cortisol is that you have to recognize what is influencing your cortisol so that you are keeping it under a certain amount during your day. What I find is that in my consultations, if someone has had acne like through childhood and is still struggling with acne like into their 30s, oftentimes there's some kind of cortisol connection going on. Ooh, my phone's about to die. Let me plug it up. Sorry, I'll get a little break. Sorry. I don't know if any of you are also the person whose like phone is perpetually dying, but that unfortunately is me. I can't even recall how many times I've been on like a FaceTime with a friend and my phone just dies. But like I'm not the chronic charger. Like I just don't charge all of the time. So it's just really funny to me how often my phone dies. Okay, so back to cortisol. So the key with cortisol is that, yeah, so I see it in women who have basically struggled with acne since like childhood and maybe are dealing with also like elements of anxiety. And oftentimes these women are like working out like way too much per week. And honestly, I do think that our society perpetuates women having cortisol irregularities because it essentially perpetuates like the 90s body schema, which is like don't eat and work out all the time. And those are the two things that will literally keep you from losing weight. Most women who are having hormonal dysregulations and they can't lose weight around their stomach, like that is usually because of a cortisol imbalance. I actually have an essay coming out in 2 weeks that gets into how cortisol actually works in the body and how to create like a low cortisol lifestyle because like that is the best thing you can do for every single system of your body. And the reason being is because there's something called psychoneuroimmunology, the idea that emotional influences interact with your nervous system. Your nervous system essentially is what determines whether or not you're going to excrete ACTH, which eventually excretes or leads to the excretion of cortisol. And it's through that mechanism that you end up having hormonal acne. Because here's what happens when ACTH is excreted, and then you get the follow up excretion of cortisol. At the same time, cortisol is released, you get an excretion of cortisol and you get an excretion of DHEA S. Okay. And so that is an androgen essentially. And that androgen is converted into testosterone. And that conversion into testosterone is what leads to this other group of hormonal acne that usually is what is targeted by like spironolactone, right? And so you have like the PCOS model of this where you've got like this excretion of testosterone and that's what's leading to elevated insulin and you get like the hirsutism and which is just like hair growth on the chin and around this region and you get just all of the effects of what happens with high testosterone, but one of them is hormonal acne from this high testosterone, okay? But there's another way you can get hormonal acne, or you can get acne from cortisol excretion, and that is through the gut. So there's a connection between cortisol and the gut, which is why you have like kids who, when they feel like really stressed, they get like stomach aches and things like that. Like that is actually an indication that you have high cortisol in your gut, and that leads to limited function of the gut. It leads to limited absorption. It leads to leaky gut and all these other things, which you'll see instead of this hormonal distribution along the chin, you'll see it on the cheek area and on the kind of like forehead area where you can see some of the gut distribution. Like I'm having a breakout right now and it's kind of in the cheek distribution. So I'm like, okay, it's probably because I'm traveling because my gut has been really funny in Toronto for some reason. But it's just like a simple way to read it. I'm not saying like my breakout has to do with cortisol, but I am saying that the gut distribution is here, and sometimes you see the gut distribution because of cortisol. So I I definitely have had in my skin consultations variations of all of these models of hormonal acne or hormonal dysregulations. And the thing about those is that if you look at acne and you look at what's genuinely happening at like a cellular level, you are taking generalized bacteria, sebum, that kind of thing, and it is leading to invaginations into the epidermal skin layers, like deeper epidermal layers. You got like 3 epidermal layers, and then you get into the dermis. Invagination and inflammation. And so the inflammation is generally where you see like people who are more prone to like that cystic kind of acne profile. And that profile has to also do with internal inflammation within the body. So maybe next time I'll talk about like inflammation and acne, because there's a couple of different mechanisms by which like that happens. Like if you hear about like people who have acne because of like histamine intolerances, or they've got acne in combination with all of these other kind of autoimmune profiles or chronic illnesses, that's more of this kind of like inflammatory mechanism. And that's like a whole different a whole different explanation. But those are like the general gist of the mechanisms at play when you have someone who has hormonal acne. So I'm usually, when someone comes in and I'm looking at the skin map and I'm like, it's more than that. Obviously, you have to hear their story. You have to, figure out what is really this person's like root thing. And everyone is very different. Um, Especially even if within the people who have hormonal acne, who you're like, okay, you've got hormonal acne, your reasoning might be so different than the person next to you. And it's really about getting into those intricacies and starting to kind of understand what could be causing that stuff. So I hope that was helpful. Does anyone have any questions before I get into some of the questions that I got on my Substack from some paid subscribers? Mm, okay, I'm not seeing any. And feel free to ask about, I mean, you can ask about hormones and acne, you can ask about health, you can ask about makeup, clean beauty, skincare. What else to write about? Life stuff, you know. I feel like one of my favorite topics is how your life is leading to your health issues. Because that was me for so long. Um, okay, I'm just pulling up my messages on my computer. So when I do get people who upgrade to paid subscriptions, I send everyone like a personalized message just to let them know that they can, you know, message me with questions at all times. I monitor my inbox and I either respond to their question in my inbox, or I'll bring it up in a live that month if I think it's something that everyone can benefit from hearing. And one of the messages I got, genuinely, like I just pulled it up, it just makes me like a little bit emotional, because I feel like you don't know how you're influencing and affecting people until you get it like reflected back to you oftentimes. And I think that, so much of where the world is moving is like this idea that our contributions, like your purpose, your way of moving through the world and impacting the world is so much your own, and it's becoming very like individualistic. So it's just like nice sometimes to like hear how you're influencing other people, because sometimes you're just doing what feels right to you, like I feel like this apothecary and everything I do here is just, it's just what feels right to me. Like I'm writing about cortisol because I'm interested in it, I'm writing about it because it really impacted my life. And or I write about the liver because I was the one who was estrogen dominant and what didn't have adequate excretion of it. Or like I had to go on the bean diet for like a pretty dense amount of time to like get my estrogen together, because so it's just like it's just makes me emotional sometimes when I get messages and it's people who are saying like how impactful like my work is for them and like how uh like influential it's been for them. Like I got one message from someone and they were like just like the way that you like express yourself and like tell stories of like your struggles and things like that has like really helped me to like express myself. And I was just that is like that is so freaking special, and I feel like there's nothing better than that, like, because for so long, I was the one who didn't know how to express myself. I was the one who didn't, have uh, that know-how to, like, write these stories and have an impact, and felt uncomfortable doing it. Like it's hard putting yourself out there. It's hard being visible. Okay, so I just got a message. Is the bean diet good for women who are menopausal? Yes, the bean diet can be good for women who are menopausal, specifically because it can help you balance out your hormones. I think just in general, women should be eating more beans than like anything else. If you look at other cultures around the world, Africa, India, even like Asian cultures, you're gonna find that lentils and fiber is such a big portion of, I mean, even like Latin America, South America, like beans and lentils are such a big part of their food groups. And I do genuinely believe because they intuitively understand that beans are what helps you regulate your hormones. So I do have a post on menopausal recommendations. It's not just like beans, you kind of have to do other things for sure. That post lives in the body edit and it talks about kind of what some of the foods are you can eat to start regulating your estrogen. Uh, and yeah, it gets into like phytoestrogens and how those can actually, once you hit menopause, how those can actually be good for you. It's a really interesting dynamic that happens. Like premenopausal, you don't want phytoestrogens because that can essentially confuse you enough to lead you into perimenopause. But once you hit menopause or perimenopause, that's when the phytoestrogens actually start to help. Mm, can you tell me how the liver is influenced by cortisol? That's an interesting question. I wouldn't say that cortisol has a direct effect on the liver. I do have a post coming out in 2 weeks that essentially gives an overview of what cortisol does in the body. It's something called let me just see if I can pull up a picture for you. It's something called Cushing syndrome. And when I learned about Cushing syndrome, honestly, this is like one of the scariest things I learned about in medical school. Like, I feel like I still have nightmares about Cushing syndrome because it's just the craziest. I don't know if you can see this picture, but I'll just read you what some things that can happen with high cortisol are. Now, these are the extremes of it all. uh the liver isn't directly affected to it, but I can tell you how it was affected to it. But let me just read what high cortisol does. So it can lead to mood changes, psychosis, depression, changes in the eyes, hypertension, peptic ulcers, usually from acid secretion increases with high cortisol. You get a body fat distribution that changes. So you get like more fat in the abdomen and then kind of like a kind of swollen face. They call it moon faces, but it looks like just basically like a round face. You start to have like a butt chin, like not everyone with a butt chin has moon faces. I just want to say that. But like if you didn't have a butt chin before and then you start having a butt chin, you could be getting like moon faces. You get muscle wasting and weakness in your extremities because it's hard to produce muscle with high cortisol. Um, your bones start to kind of break down. You can get some easy bruising, poor wound healing because you can't really heal with high cortisol. That extends to outside healing and internal healing. And then the effect that I talked about with high cortisol is that you get that testosterone increase, which is what leads to the acne, hyperpigmentation, increased body and facial hairs, and menstrual changes. So There's nothing that cortisol doesn't have a receptor on the liver that's leading to anything particularly on the liver. But what I will say is cortisol affects the immune system, and the immune system is a mechanism that acts on every part of the body. So, in the liver, for example, if you've got damage in the liver, the immune system is what's going to help clean up that damage. And so, if you're someone who has uh like fatty liver disease for whatever reason, like you could have like familial fatty liver disease or just like alcohol induced fatty liver disease. If you've just got a slow liver of any sort of amount, the immune system is what's going to come in, create an inflammatory reaction and heal that for you, and you're not going to get that if you have high cortisol, essentially. So that's the only mechanism I can think of that directly is cortisol affecting the liver. In general, obviously, having high cortisol just slows down the organ function. Like your body doesn't know what to do by way of all of those things that I shared, like cortisol, just your body does not know what to do with it. Like it genuinely just can wreak havoc on so many areas of the body, but I wouldn't specifically say that it has an interaction with the liver. I can check that, but I'm pretty sure there's no interaction directly between cortisol and the liver. I hope that answered your question. Um, okay. So I forget what I was doing. I was answering questions. Continue to ask questions on here, but